Okay, good morning, everyone. We are here for the Behavioral Health Committee for the Incarceration Prevention and Reduction Task Force. We're here on October 17th and we're meeting virtually. And I'd like to begin by reading a land acknowledgement statement. So before we begin our meeting, we acknowledge that we are gathered on the traditional and unceded territory of Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We believe this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. And I'm going to call this meeting to order now. And I'm here with my co-chair, Mike Parker. And the first item that we're going to be talking about here is competency restoration. This is continued from the September joint meeting with the legal and justice systems. And here to provide an update is Perry Mowry from Whatcom County Health Department.
Good morning, folks. Perry Mowry, Response Systems Division Supervisor with the Health Department. So a little bit about the Competency Restoration work group. This work group has been meeting for about the last 6 months or so. It includes several representatives, judicial officers, as well as some members of our behavioral health subcommittee and some citizens. The reason that this work group was pulled together was to really take a look at the challenges that we're facing relative to competency restoration. I think that most folks are pretty familiar with the challenges relative to available space at Western and Eastern State Hospital. This results in situations of where incarcerated individuals in the Whatcom County Jail are incarcerated for extended periods of time, waiting for competency restoration. The actual assessments and intakes for competency restoration are happening pretty regularly, but available space to actually provide that competency restoration is a challenge. So we began in this work group looking at, possible avenues to address this. Everything from, communicating with legislators in terms of the need for available competency restoration inpatient settings, to taking a look at the possibility of assisted outpatient treatment services that could treat individuals that were appropriate for an outpatient competency restoration, and also even a regional inpatient competency restoration location that would be work that would occur within the North Sound region, the 5 counties of the North Sound region. One of the other things that we looked at, and I thought that I would talk most about today, there are also options of what's referred to as prosecutorial diversion programs. These programs, there's actually 3 programs set up, 3 different counties that have prosecutorial diversion programs. That would include Spokane County, King County, and then there's a combination Benton, Franklin counties that serve a number of individuals per year. Essentially, my understanding of this is that this allows the prosecutor's office to basically drop the charge and refer the individual to a prosecutorial diversion program. I did want to make clear that the difference between a lot of times there's not a full understanding of competency restoration, and I think that that's an important component. Competency restoration, the entire purpose of competency restoration is essentially to work with the individual to bring them to a point of where they can understand the charge that is against them and that they can assist in their defense in those given situations. And oftentimes it's misunderstood that the process of competency restoration has more to do with behavioral health services being provided to the individual. I mean, that's true to some extent, but again, understanding that whether we're talking about assisted outpatient competency restoration, or if we're talking about inpatient at Western or Eastern Hospital, the entire purpose is to return the individual to a state of competency so that they can stand trial, and then they're returned to the jail to carry through that judicial process. The difference in competency restoration and the prosecutorial diversion programs is that the prosecutorial diversion programs, as they've been designed at this point in the 3 counties that I made reference to, are about addressing the individual's mental health, their needs. This can include a number of components of social determinants of health, that being behavioral health support, housing, obviously medication can oftentimes be an important component, and other case management types of roles that would be played. So a significant difference between prosecutorial diversion and competency restoration. But of course, the idea is identifying individuals that are in the jail that are awaiting competency restoration, approaching the prosecutor's office to drop the charges and refer the individual to those services. I'll stop there. Mike, looks like you have a question.
Yeah, if you don't mind kind of peppering in the middle, I know you were kind of in stride, but it was right when you were talking, and it made me wonder 2 things. Recently we had a really good presentation about our from Jake Wybush, right, about services done. And, can you characterize the services under prosecutorial diversion? Are they done through like probation officers? Do they have some kind of attachment on going to the court? Is one question I have. Just functionally, what would that look like? I know that Prosecutor Ritchie's not here with us, but I'm sure he's familiar with these, but I'd love to get his take on it and to what ongoing role they have with folks diverted. And then I guess, Perry, if you wouldn't mind touching on for us, what you're hearing are the common charges that people are diverting, and maybe is it really the charge difference that will lend itself to a prosecutor wanting to maybe divert somebody and drop charges for the person getting services versus no, you need to get your competency restored so that you can stand trial because the crimes are heinous. Is there any? Can you give us any what about the types of charges?
I think I can offer just a general sense of that. The programs that are in existence at this point are oriented towards individuals that have nonviolent crimes, but I don't know any more extensive, aspect of that. Of course, it does depend on the prosecutor's office and, their decision in terms of, the individual. And the nature of these existing prosecutorial diversion programs are, orienting towards essentially, my understanding is that they are from 6 at a minimum to 12 months of involvement. The individual would get an array of support and resources that I had mentioned, depending on what those needs are. And the existing programs are not run by the court or any kind of probation. They're actually facilitated by, and I'll go into this just a little bit. The structure is actually a director, a program manager that's clinically credentialed, 2 case managers that are, of course, assisting in that connection to resources within the community, a certified peer support specialist, and a 4-hour minimum per week, 0.10 FTE prescriber. So, and the programs that and I'll talk again more about this, we're working with the Office of Forensic Mental Health Services. Their goal is to see between 50 and 75 individuals served each year in the programs, and they have some funds available to it. I'll sort of speak to that piece as well. So sorry, I don't have more detail in terms
No, that's
of.
great, Perry. I think that's
Okay.
helpful.
Okay. Looks like, oh, go ahead.
Yeah,
Dan.
yeah, Perry, Courtney Taylor has her hand up.
Hi, just on competency restoration, having worked in outpatient competency restoration and now seeing it on the other side with the PD's office, I can say that a lot of the crimes that folks are accused of, that are navigating the restoration system, they're things that we might call poverty crimes. So trespassing, burglary, things that are not, necessarily violent. We are not having a lot of success with having the prosecutor dismiss charges. And there are actually a lot of people that if you have an intellectual or developmental disability, you're considered non-restorable after 2 periods of restoration. But what we're finding is there's a lot of reluctance to actually follow that. And you have a lot of people that are cycling through this process multiple times because the adversarial system insists that they will at one point be well enough to be sentenced, and some people are not. And there are backlogs for a lot of reasons, but we are not seeing a lot of movement or flexibility or willingness to consider other options. When the restoration system just is not, it's not working for some cases and for some folks.
Courtney,
Hey, Courtney, can I ask you to expand on that just a little bit? When you mentioned folks that are considered non-restorable after 2 of these sessions, what is the outcome of for those individuals?
Well, not necessarily sessions, but periods of restoration, and it
Yeah.
can the outcome can vary by case and by person and by the counsel involved. But usually, what I see is it ends up being a civil flip, and then there's a lot of backlogs in that side of the system as well. So we have the same people that are kind of rotating between 2 different parts of the system.
Courtney, if you don't mind, I'm going to ask you one follow-up, and Perry, I'm going to beg your forgiveness just to go down this this track just a moment. You obviously have a lot of understanding and experience, and have witnessed, this process over your tenure. What is your suggestion for those individuals? You mentioned that some people go down the road of a civil flip, but that is fraught with obviously an overclogged system, and that has its own hassles. But if it was Courtney's magic wand, what would you do for those individuals? What would you suggest?
I mean, I don't think any one person has an answer. I think it goes back to
Sure.
There are a lot of things that we call crimes that we completely displace people and blow up their lives trying to get some kind of resolution that doesn't really, it's not really a long-term solution. And like Perry said, restoration is not treatment. And we spend a lot of time trying to restore people when they need treatment, and cases need to be dropped instead of putting people through this for months to years with the hope that they will be well enough to squeeze water from a stone, essentially. So I don't think I wish there was a magic wand. I wish there was a simple solution. I don't mean to imply there is. But we spend so much time not treating people, and by the time they're through restoration and they have to come back to the jail in an environment where they don't have ready access to medications, there's a part-time prescriber, there's all these other logistical issues that we've outlined on this task force. It all feeds into that long line that's waiting on both sides, with the civil side and the restoration side. And some cases just need to be dropped. And how that's determined, I certainly, that I am not the only person that can speak to that. but restoration is not treatment. And there is a huge delay between when someone is charged and when someone's actually receiving treatment, either before or after the periods of restoration, depending on when that question of competency is raised. I mean, you get medication management at the hospitals and an outpatient competency restoration, but most of the time is spent in classes, in their core classes. You have courtroom knowledge, you have what they call optimal symptom management, you have relaxation and coping skills and effective communication. And then there are supplemental groups depending on the person's needs, like if they have a thought disorder. But there's really not a lot of, and then, you know, there's activity classes, or if you're at the state hospital, there's, you know, some recreation classes that are separate from restoration, but it's not treatment by any means. And we know that there's already a lot of different things that feed into the timeline of a case, and restoration is just one more thing that I'm not saying it's not needed. You need to know if someone's competent or not, but the amount of time we spend on those cycles and someone's returning, coming back to the jail, and their case still isn't able to move forward, to have a prosecutor insist, no, you know, they can get to a point where we can drive this through. Some things need to be dropped.
Thanks, Courtney.
I see Stephen Gottlieb. Yeah, thank you, Courtney. I see Stephen Gottlieb's hand up.
Yeah, I just want to follow up. I think the point I take from Courtney's observations is a strong preference for prosecutorial diversion approaches, which seem to be a pathway to treatment, as opposed to much of any utilization of a competency restoration process. And so that makes me wonder, Washington State probably isn't the only place trying this. I'm wondering if we know of models and best practices elsewhere. I'm also interested in what data, if any, there is in prosecutorial diversion programs for the degree of cooperation, which is not high in the most standard treatment diversion kinds of programs, and what the outcomes are at the end of those 6 to 12 months of prosecutorial diversions, and what the approach is of programs when those outcomes are not very successful. What subsequent steps are there to deal with folks like that?
Great questions, Stephen. And at this point, we have had some interaction with the King County program referred to as LINC, L-I-N-C. And also, just in terms of an understanding, the prosecutor's office dropping the charge, referring an individual to the LINC program, for example, and I don't have as much detail about the other programs, it's not contingent on the individual completing. It is simply dropping the charges. There's no other involvement with the prosecutor's office at that point in time. I do understand that one or more of the other programs that I made reference to in Washington do have some contingencies, somewhat like the mental health court of an individual is referred to complete that program, to remain in compliance, et cetera. And it is contingent on their charge being dropped. I've, certainly offered no suggestions or recommendations in that regard. So it's just information, if you will. I have not gone as far as determining, efficacy and outcome. When we had that discussion with the LINC program in King County, they have a number of individuals that are involved in the prosecutorial diversion program. And I didn't get a sense that at that point anyway, that they had shared outcome data in terms of efficacy. What I would say about an individual, and I'm just surmising here as opposed to, any detail, that the intent, of course, is for an individual being involved in, I'll just say PDP because it's kind of a long statement, is that the individual is connected to those resources with some very strong case management. And what we find, and I could speak to, for example, mental health court as well as recovery court, is that the outcome tends to be pretty positive in general relative to that intensive case management and the services. The individual certainly could continue on with ongoing support, whether that's behavioral health, housing, et cetera. But those components are certainly important. And as you know, we face, challenges within the community, just relative to those resources, workforce, challenges, those kinds of components that I think would also, the prosecutorial diversion program itself is a, supportive program, obviously, but it absolutely depends on the resources that are in the community. If those resources aren't there, then it tends to be more of a holding place for individuals. And so I think that's certainly something that we have to take a look at as well. Sorry, I couldn't answer your question with more detail.
No, that's okay. Just a quick follow-up. I think that went to what my interest was in asking the question, because we don't right now have adequate resources in intensive case management. We don't have adequate supportive housing. This would be a very intensive program, but it would draw on the same inadequate resources that so many of our attempts at diverting and treating rather than incarcerating would. And I'm just wondering if this would be the most effective use as we build up capacity in the community to do that. I mean, I hate to triage that way, but I think we're going to have to for the next few years. And so I think it would be important to know whether this would be a good place to put those efforts in, or others might bear more fruit in sort of addressing treatment needs.
Heather Flaherty has her hand up.
Good morning. I love that question, Stephen, about the efficacy and outcome data for prosecutorial diversion programs. It made me think it would be actually a really fascinating research report to look at the outcomes across all the programs. So what are the outcomes of LEAD, of GRACE, of drug court, of mental health court, or recovery court, and compare that to the outcomes when we do nothing, when people just go through the system as it is currently set up. And I wanted to share that I was given a great privilege to do some deep analysis on a sample of prosecutor files locally. And it's still kind of confidential, but one thing that is just so heavy on my heart is that 46% of the individuals started committing crimes between the ages of 13 and 17. And 8 out of 9 of those were there were drugs somehow either part of their history or part of their charges. And when you look at, sorry, my baby's coming over to show me her doll. Hold on just a second, honey. When you look at actual stats of deviancy in society, right, it's like 1 to 3% are true sociopaths or psychopaths, they estimate. So it's not that all these people are actual deviant people. It's often that there's some sort of circumstance in a child's life that we are not addressing. And those people actually had they carried the most recidivism as well, the most repeating charges, which is just such a driver for me of how can we make this system there's so much opportunity to get better outcomes and stop seeing that recidivism. So I'm super interested in your question, Stephen, and would love to compare it to what are the outcomes of the system as it currently is, because I think we would all be really aghast often at like, what is that long-term, like Courtney was saying, what is the long-term impact and outcome of what we are set up to do? So
Courtney, did you want to speak to that or?
Yeah, I just wanted to thank Heather for that and say that, yeah, what she's talking about, it's very real. And I think a lot of us on the call are acutely aware of the generational toll, and the people involved in this system are not, our clients are the forgotten ones. They're the ones who, most of our clients, they were foster kids themselves, or they had no stable home life, or they had no access to, not even just one thing, multiple things, limited housing or no housing, poor access to resources. Education was rough, a lot of abuse, a lot of trauma. And then you look at the communities they came up in, what's the service network look like? How easy is it to navigate? Are people receiving the care they need from birth to adulthood? And it's the people Heather's talking about, we see it every day where they've been system involved, not most of their adulthood, but most of their lives. And their parents may have been too, or another family member or caregiver. I mean, there's a reason, a very real evidenced reason people talk about the prison industrial complex being an extension of slavery by race and by socioeconomic status. This is very real today. That people are not, and there's a lot of misconceptions about sociopathy and psychopathy, and I could go off on that rant about the DSM, but that's for another day. But people are not in this system because they chose to be.
Thanks, Courtney. And thanks, Heather. And it's a great conversation. Perry, do you want to continue?
Sure. Yeah, you're right. Absolutely great points. And many of them are actually in my notes here, or at least referencing to that. So, again, sort of going back with the challenges, at least the way that I see it, relative to competency restoration, and being able to address the issue of individuals remaining incarcerated for extensive periods of time and not receiving competency restoration, and those challenges. So the competency restoration work group, again, looked at assisted outpatient treatment, which in essence, or if you will, an outpatient competency restoration, sort of talked about what the goals of that are and how effective that might be. Again, I don't have research, but just some concerns around the resources that we have in our community, what the goal of outpatient competency restoration is, in its limitations, the likelihood of inpatient competency restoration system improving, and the challenges that we've seen in those regards, and the extending timeframes, and then this other approach, obviously, in terms of the prosecutorial diversion programs. It won't address, of course, all individuals that have this need relative to competency restoration or support in terms of their serious mental illness, but it does begin to lean into more of the challenges of the individual. From my perspective, anyway, it leans more into the challenges that individuals have in bringing resources to that, to that challenge for an ongoing support and reduction in terms of interaction with the judicial system, law enforcement, that sort of thing. So originally, these three programs that I talked about in Washington that have been established, as we got some presentations from the Office of Forensic Mental Health Services, and my understanding was that Whatcom County did not have an option to be able to pursue funding that obviously King County, Spokane, and Benton Franklin had received for the prosecutorial diversion programs. And then I went to a presentation that was actually a part of a county coordinator meeting with the Behavioral Health Administrative Services Organization, and an individual that came in to present. His name's Jason Carpin. He's a liaison and diversion specialist with the Office of Forensic Mental Health Services. indicated that there were actually some funds that were available to support and initiate prosecutorial diversion programs, which came as a surprise to me because my understanding, again, in the presentations that we had received in the Competency Restoration Work Group, indicated otherwise. So I pursued that further and gathered just a little bit of information that, again, OFMHS, the Office of Forensic Mental Health Services, had actually approached the BHASOs across the state with a discussion about contracting or funding coming through the state to the BHASOs. And then being parceled out to interested counties, similar to other contracts that we have for, jail services and et cetera. The BHASO, I don't know the history of this, but the BHASO declined to engage in contracting with the Office of Forensic Mental Health Services and encouraged the office, Jason Carpin, to actually begin to communicate with the counties directly. So that's how I sort of came across this information. Obviously took it back to the Competency Restoration Work Group and have been communicating with Jason Carpin, since that point in time. So essentially, without going through a whole lot of sort of history and detail, the Office of Forensic Mental Health Services plans on submitting a supplemental funding request to the governor's office. And they, Jason and other individuals in this office, were out communicating with counties and saying, listen, if this is something that you're interested in, we would certainly be interested in contracting with you. But they are preparing to, as I said, approach the governor's office relative to request for funding. And that will occur in the first part of the year. Jason had made a request of me to put together a estimated budget for initiating a prosecutorial diversion program in Whatcom County. Essentially, the time frame is getting pretty short for me to provide that information to him. He is needing that prior to the end of October for the ask to the governor's office. Although also, so I want to make some clarification here. Submitting this estimated budget is not a commitment at this point in time, but it does speak to the Office of Forensic Mental Health Services being able to have figures to be able to approach the governor's office. There is, of course, a process of application, proposal to the Office of Forensic Mental Health Services. And the target date for that, as I'm understanding it, would be April 2024 in order to receive funding and initiate this process by July 2024. There's also an additional date, just moves the whole process forward by a year for 2025. And so the steps that I've taken at this point in time is, well, we can put together an estimate of budget based on the Office of Forensic Mental Health Services ideal model, in terms of staffing and et cetera. And that's something that I'm putting together at this point. The question then becomes whether this service is, Stephen?
Well, I just, I didn't mean to interrupt exactly, Perry. I'll throw it out and you can speak to it if you want as you go. But I'm struck at the abstraction of where we are with this. On the competency restoration conversations, my assessment is that Prosecutor Ritchie has had mildly positive hemming and hawing about his participation in this kind of program. I haven't heard any reports of talking to provider agencies who one might contract with. So I think you're on the verge of asking us to consider this kind of initiative without some key players actually buying into it, and I'm wondering where that step in the process is going to come in. I'm glad Kayla is here because it also sounds like a piece of her policy advocacy would be necessary here as well.
Harry, do you want me to chime in, or do you want to try to, what do you want me to say to you?
Yeah, you certainly, absolutely.
Stephen, we are at this point, and when we get into the state legislative agenda stuff, you'll hear it more, intending to support the state request for more prosecutorial diversion funding and teeing up Whatcom County as a pilot site. So coordinating closely with Perry on that. We do have support from the prosecutor. We've had conversations with him. He is supportive. Both Eric Ritchie and Eric Sigmar have expressed a lot of enthusiasm for diversion in the conversations they've had with the executive's office. I think it's the capacity to put all the pieces together that we're really struggling with, and it gets us in some of these circular conversations. So I think our office is trying to be helpful there, while also recognizing ultimately it's going to be the prosecutor and the public defender that are going to have to take ownership over this. And so how do we tee that up and get them the support that they need to like sort of set a framework for what gets diverted at what phase in the process, and what type of diversion programs we want to have. And then obviously our health department is going to play a really key role in managing contracts with providers. And, it's like there's a lot of justice system reforms we are working on, right? Like the Crisis Relief Center, prosecutorial diversion. And so we have to just with capacity, sort of prioritize and triage the rollout of those. And I guess we're just sort of working through how to do that, but getting a sense of this group's perspective on the types of charges, the health status of individuals, like who are we most interested in diverting from the system and at what phase. That feels like a really good place to start.
Mike Parker.
Kayla, thank you for that. That was key timing. So I think you kind of answered some of those questions, and I think that's real important to know that we do have a prosecutorial support. As I listened through this, and I think about Ann Deacon telling us about the PETA continuing and asking us to think broadly across it. And Heather obviously was talking about before things even start, right? How do we support families and children so that they don't start? The other part of me is very pragmatic and sees the challenge that we have today. And individuals are grown now, and we need to help them. And prosecutorial diversion, while I looked and briefly found a national database that will connect us with a variety of different programs. And I just offer that Spokane, I think, has had some evaluation. Brian Estes last year shared with this particular subcommittee kind of an ambivalent auditor's report from King County about their program, that it just didn't have a lot of efficacy data. So I agree with the caution and studying and making sure that we research and get something that's well structured and that we can evaluate for its efficacy. But in terms of charges, I haven't done a ton of research, but I think that could be low-hanging fruit to get the common ones. Obviously, the prosecutor would have to do it. I was going to share my screen, but I think I won't do that. But Spokane's information is right on the website, and it's pretty much what you would think. It really addresses some of the crimes that Courtney talks about. These are kind of lower-level crimes. Felonies are not really considered unless they're very low level and case-by-case basis. We're basically talking property crimes, misdemeanors, criminal mischief, and things like that. And then diverting people into an array of services and supports to do that. One of the things that I like about that, and I'm going to tie this to one other community event that happened over the summer, which is Sam Quinones coming into town, and talking a lot about the particular drugs that are affecting individuals and in causing actually some of that behaviors, right? And for some folks that are fully grown, right? So we kind of miss those early stages of intervention. We're dealing with adults now. The run-in with law enforcement can be an opportunity. And I think we're squandering the opportunity if we can't find ways to connect people. And I love our Lead and Grace programs because I think they're dealing exactly with this. Prosecutorial diversion, in my just barely educated opinion gives us another avenue and another engagement point, and a time to not fill a jail and to maybe divert individuals, from something that's not going to be therapeutic in any way, and that will probably just encourage recidivism. And it may be, in terms of expenses, less expensive than some, and everybody may not be eligible for it. But based on what I see, what I hear today, and you're asking, the committee's opinion, I would just offer that this bears, some strong need to look into how this could be lifted up in this community, and how useful it could be if they're standing in front of the prosecutor, they're going to go that way, and we can divert them and get them into services, but also to their health, to address the health side of things. The programs that I see usually require abstinence, and that could give somebody a unique opportunity to do something different. And so that's what that ties into, I think, when we're looking at the opioid epidemic, and Sam Quinones is talking to us. I think we need to find a way to do that, and it doesn't need to be in jail. It needs to be outside of jail before they get into jail. Anyways, I would just offer those things of support, and want to thank you in the exec's office for looking into it. But I think, as you mentioned, we get into the circular trap of who's going to do it. And I don't have a path forward, but I believe that which is so important, like a 23-hour center, which is absolutely critical in our community, that we need. I would put this up there in based on what I've seen so far, this seems a lot more likely to be able to lift off the ground than would an outpatient competency restoration program, based on what Perry has been able to bring to us, the presenters that Perry has brought, and then not just Perry, but he's been a real leader for the group in that. So I'd just like to offer that, and thank you.
I see Heather Flaherty, then Courtney.
I just wanted to clarify that one point, of course, is investment in youth and prevention. And there's a lot of really high returns on investment. But I think another point for this committee is the system outcomes. And that's the opportunity that we have, I think, as a committee, to look at how can we make this system perform in a way that we see better outcomes. So I just wanted to make sure that that was heard too, it's not really working that great for a lot of people. And Kayla, I love that question about what input is helpful from this committee for what kinds of charges might the community support in a prosecutor diversion program. And I would love to start with the top bookings, right? And see, like, is there kind of an efficiency matrix of if the top two bookings are DUIs and assault, right? Like, that assault's a huge range. So that's a lot of throughput in a jail that maybe could help us on the efficiency side if we could find a restorative justice or a diversion opportunity that is appropriate without losing the accountability. I think that's really important too. Like Mike said, these are grown people and they should have some accountability. But also, I think another interesting angle, if we had the data system to support it, is aging cases, right? What are the age of open cases? How many of those are still in our jail pre-trial? I think a lot of our cases are actually open quite longer than we would think. They're not getting resolved within a year. And so what are those charges? What are the commonalities there? And is there an opportunity for a successful diversion based on like the top 3 to 5 most common reasons for a case being open 1 year or longer? But I don't know if we have that data. And so it's hard to answer your question without knowing, well, what's the current state of charges and cases? So where are the opportunities?
Thanks, Heather. Courtney.
I was going to speak to something Mike said, but just real quick to close the loop on what Heather was saying. I just want everyone to remember that, the charges you see on the roster charges can be reduced. What you're seeing is the initial, what is being said at the get-go. It doesn't mean that that is how the case will be resolved. It doesn't mean that there are negotiations still happening and things are still active. And that label that might be applied to a person's charge is not always accurate, or ends up, it's not always what sticks. And what I was going to circle back to what Mike was saying, diversion is not happening. Things are happening after people get new cause numbers. People are not being diverted to triage. People are, the hospital sending people back to the jail when they're seeking medical services at the ER, or trying to get some kind of mental health stabilization if they can't get to triage. We have a lot of folks that are voluntary, more than willing to seek services there, but this perception of, well, maybe contact with law enforcement's what they need and this will save their life. It could be if they were actually diverted, but that is not what's happening. And we contact with law enforcement is not always the saving grace that we might think it is for some folks. And on the note about abstinence, we have known for a long time now, the evidence is clear. Expecting abstinence is not effective. It will not work. For some it does, but it cannot be a blanket expectation for some of these diversion programs. Harm reduction, the evidence is there. It's clear. We can see it happening in other communities that have these programs up and running. And when we rely on contracting out and creating these programs around our local nonprofits that are already strapped for staff and cash, what's the saying, that we're robbing Peter to pay Paul. I mean, we're not really, where are we diverting people to if there's no housing and there's no behavioral health services that can adequately take on that clientele? It's like Kayla was saying, it's a whole spider web of issues that it's going to take multiple people, different levels, triaging different things. Nothing's going to happen all at once. But when we're talking about diversion, where are we diverting people to? And right now, things could be better. There could be more options for where people are going, but we do have some things in place right now that law enforcement are not utilizing, and prosecutors are not working with us on some things. But I do see them voicing their support. I will give them that. What's happening in the field and what's actually happening with the gatekeepers of the system on the ground, it's not the same as the communication we're receiving at the top.
I'd like to respond to something Courtney said, and Courtney, I apologize if I came across as saying that was, helpful. I think we're squandering opportunities for individuals who encounter law enforcement. We're currently not using any help that might lend the person. I'm not indicating in any way that is the way to treatment. And you're correct. People seeking voluntary treatment is in the research works far better. But on the other hand, currently, as you so rightly stated, there are no programs really to divert those individuals to. So any possibility of a different path or an entryway to treatment are being squandered at this point. So certainly not advocating for that as the way that people would get that, but certainly want to use any opportunity that we can by wrapping that person in resources. Just wanted to clarify, and thank you.
Stephen Gockley.
I'd just like to underscore Courtney's point that it's pretty easy to talk the talk, and what we really ought to keep our eye on is walking the walk. So as we try to build something here, we need to be looking beyond expressions of support and seeing what actual practices and policies are being proposed and adopted, and how they're being carried out. So I think building in some kind of data and oversight right from the beginning, and this would be with entities like the prosecutor's office that are not particularly in favor of being scrutinized like that, might be a necessary component of trying to develop PDP approaches.
Thanks, Stephen. Just a quick time check. I think we're at about 9:52 here, and I want to make sure that we have enough time for our legislative agenda here. Perry, do you want to just kind of wrap us up on this topic?
Sure. And, one of the things that I certainly want to say, it's been interesting working with the Competency Restoration work group. It is sort of an ad hoc, gathering of individuals that I joined into mostly because of my background in behavioral health services and SUD services. And at least from my perspective, coming from that kind of background, to individuals' points, developing an assisted outpatient services within the community, or a outpatient competency restoration program, or having faith and hope in what the state is doing, although they continue to make efforts. Jason Carpin from the Office of Forensic Mental Health Services said, we're not going to build beds out of the challenge and the problem, and we've really recognized that, and we're looking at alternatives from there. But my point being that it's like, well, if those are the options that I sort of listed, at least from my perspective, a diversion program that was available that had some of the specifics, particularly a prescriber, and that intensive case management oriented towards those specific clientele, which are high acuity clients, and are going to need a lot of extra support in that regard, made the most sense to me, as opposed to myself necessarily advocating for it. It's like, well, of those options, if there was funding available, it'd be something well worth taking a look at. And to individuals' point, doing the research, and etc. My sense is that the time frame is pretty short as far as the possibility of funding. But again, as I had mentioned, another framework of that was actually a year out. But going ahead and starting to take a look at, well, okay, what would this cost? And also, at least again, from my perspective, the way that I'm developing the budget estimate at this point in time is that the county would be a pass-through entity, and that it would be provided by, I think, a certified behavioral health agency as opposed to the county itself. But that isn't my decision. Obviously, we have diversion programs that are being provided through the county at this point in time. Again, being a staff member of the Response Systems Division, I can certainly say that there's a lot of new programs. I think that they're pretty fantastic. Expanding further instead of stabilizing the programs that have been initiated, I'm concerned about that, just because there is as much growth and development. So my sense, and at least some initial discussions with my my supervisor, and I don't want to speak for her, but that this wouldn't be something that the health department response systems division could take on. It would need to be a provider in the community. So it's interesting because a lot of the communication and discussion certainly comes back to very real situations of where workforce challenges and those sorts of things are occurring. I've often reflected on the fact that I think in part that was really impacted through COVID. We've been through a fairly interesting time frame relative to behavioral health and health services in general, and the tendency to talk about the possibility of developing a program, diversion or otherwise, and then moving into the challenge of, but we don't have a workforce. So where do we start? Where do we begin? And I agree with the discussions that have occurred here in terms of how do we approach that, knowing as much as we can, making decisions based on data, I think are all important components. And interestingly enough, I of course made some notes in terms of the challenges and steps relative to this prosecutorial diversion project in consideration, and we've talked about all of them, within this meeting in terms of workforce availability of housing and those kinds of things, very real issues. So just wanted to offer that, kind of clarification and my position, within the competency restoration work group. I'm hired help moving towards gathering information and providing that information as opposed to necessarily wanting to direct policy, myself personally.
Stephen Gockley.
Thanks, Dan. Just a quick comment. I find this a very positive discussion and hopeful of ways that we can pursue this. At the same time, I'm sobered by the early point Perry made that the state thinks the capacity for this is 50 to 75 people a year. Even if Kayla is wildly successful in the legislature, maybe they double it. And you figure across a number of counties who would take advantage of this, we're really talking about a handful of people. I mean, we're not making much of a dent in preventing and reducing incarceration. It is a more humane approach and probably more effective for that handful of people. But I'm restrained in my enthusiasm by the lack of scale here.
Kayla Schott-Bressler.
Thanks, Dan. Stephen, I just wanted to say that we fully anticipate that if we were to get grant funding for this type of program from the state, we would augment that with local funding in order to scale the program. Not only on the sort of immediate core components of the program, but we know it's going to require housing and recovery supports and all these other linkages. So it's certainly an expensive endeavor, and we'll take a commitment of local funding to do it right.
So in wrapping this up, at the risk of stating the obvious, I think that there is some importance on creating a program or considering creation of a program that specifically is oriented towards individuals that have been identified or even evaluated in need of competency restoration. High acuity individuals, very vulnerable individuals that are going to need sophisticated and significant case management. That may be somewhat different than other diversion programs that are obviously, working with and intending on working with a specific group of individuals. Is it enough? No, probably not. But I think that it is an important pathway that is oriented towards a specific client base, and I think that is an important component as well. So. What I have done at this point is I put together a draft, a budget for this program as defined by the Office of Forensic Mental Health Services. I'm preparing to submit that, and again, the extent of this at this point in time is a draft budget estimation as opposed to any kind of specific proposal. That then is the next step to have that discussion of, all right, so do we proceed forward? Do we actually move into a proposal process with this in the Office of Forensic Mental Health Services, or do we do more research and stand by for a period of time to move it forward to the next year? So that, if I hope I've covered the bulk of that. This isn't actually all of the work that the competency restoration work group has done, but it's I think the key pieces of where we're sort of arriving at this point in the steps that I'm taking. So I'll stop there.
All right, thanks, Perry. Any other questions pursuant to this topic here this morning? Okay, seeing none, I'm going to go ahead and segue us. We're at the top of the hour here, and we need to move into the next agenda item, and that is the legislative agenda here for this group. And here to take us through is Kayla Schott-Bressler.
Thanks, everyone. And I think most of you have seen sort of pieces of this during various committee meetings over the last several months. And so what I hope to present to you today is our recommendations for what we want to take to the county council as a state legislative agenda as it relates to criminal justice system and reform. There is one really big question that we want your input on. So I'll walk you through that. And then obviously, this is not the end of the road on feedback. So just today via email, however you see fit, please keep the feedback coming. We're planning to take this to council at the first council meeting in November. So we still have a little bit of time. Okay, I'm going to share my screen. Does that work okay with everyone?
Yeah, go ahead.
Okay. Okay. Can everyone see?
We can see it.
Okay, cool. Okay. Apologies for my lack of well-designed PowerPoint, but do this quickly.
You're
Okay,
forgiven.
thank you. Okay, so separated this into policy, operating budget, and capital budget. So for the policy bills, one of our key priorities, and I don't know if it's really gonna be this year's budget or next year's budget yet, but it's fully funding the 90-day Medicaid waiver for jail-based health and jail transitions. And I think when we say fully fund, we mean to pay for the state share of Medicaid for the waiver, and also to fund local governments in capacity to get ready for the waiver. We're gonna, there's a lot of readiness work that we will need to do to implement this. And so we want to make sure that the state's providing technical assistance as well as resources toward that end. On the behavioral health side, these aren't necessarily items that we're going to have a lead bill on, but just things that we're going to be tracking, which is ensuring adequate Medicaid reimbursement rates and coverage for care, including making sure that the operating costs at the 23-hour crisis relief center are able to effectively be billed to Medicaid and private insurance to ensure that that gap request for local operating fund is as small as possible. We want to continue to support efforts to bolster the behavioral health workforce. You'll see this really closely reflects the Justice Project implementation plan advocacy priorities. We're going to be advocating for housing affordability and eviction prevention assistance, supporting bills that promote public health and addressing the social determinants of health, and then continuing to ensure this the state takes full responsibility for indigent defense, which I know there's also a lawsuit from the Washington State Association of Counties toward that end. Before I move to the budget side, do you all have any questions about any of these items?
Committee questions? I'm not seeing any. Wait, Brian Estes, go ahead.
Yeah, I have a number of questions here related to the 988 system. And it's too much to go into detail on this call, but some of them have to deal with the relationship locally between 911 and 988. And there have been set up, and I'm affiliated with the National Alliance on Mental Illness Washington County chapter, and our national organization does an analysis of 2022 state legislation in a number of areas, including mobile crisis response. So, Kayla, could we talk later, maybe perhaps about some of these issues? Would that make sense?
Yeah, absolutely. I'm happy to.
One of them, just real quickly, is related to a California bill that changed the characteristics of mental health court to include felonies in some instance and limited the time of mental health court to 1 year. And I think those are issues locally that might make sense. So, and at our next meeting, I'd be happy to talk about a few of these bills that I think have applicability to Whatcom County. And also, I don't know if the committee members are familiar, but there is model legislation on 988 that was developed by the National Association of State Mental Health Program Directors. And I think, I haven't reviewed that in detail, but I think there might be a few elements of that that relate to policies or programs under the control of counties. So I think that's worth considering. And just finally, I'll just mention one thing. This isn't necessarily for our state legislature, but I think going forward in terms of capital planning, we really should consider co-locating 16-bed facilities right next to each other, which you can do, because there would be tremendous economies of scale for doing that. So I'll just stop right there.
Thanks, Brian. And happy to talk more.
Hey, Kayla, I've got a clarifying question, I guess. So in that first bullet point where it says fund the 90-day Medicaid waiver for jail-based health and jail
Yeah.
transitions, is that intended to affect the suspension of Medicaid while people are incarcerated?
Yes. So just to back up a little bit, when people enter a jail or prison, their Medicaid is turned off. This is federal law. I think as counties and communities across the country try to work to change that federal law, they've gotten a little frustrated. So in the short term, states are pursuing waivers with the Center for Medicare and Medicaid Services. Washington State did get submitted and got approved for a waiver that would allow the use of Medicaid in jails and prisons in Washington State for 90 days pre-release, and that those services would be health services as well as case management, care coordination, jail transitions, reentry type services as well. So the healthcare authority is in the process of implementing that waiver, and the state has to pay for it.
Okay, thanks for clarifying. And then that second bullet point under behavioral health support efforts to bolster the behavioral health workforce. Can you just provide just a simple level of detail on that?
Yeah, I mean, there's no particular bill in mind. It's more of a push, like a general policy push to the legislature around these workforce issues. And I'm sure at its core is a connection, right, to the reimbursement rates, what we're able to pay people who work in this field. And so it's just our flag that we're going to be tracking bills related to that and signing in support for bills that we think will be effective in having a positive impact on the workforce. But it's a statewide issue that we don't, I don't know, there's no local policy solution that we've come up with that we're trying to promote. It's more of a flag around the need.
Got it. Okay, so I just saw a flurry of hands. Mike Parker, Peter Frazier, then Brian Estes. Mike, go ahead.
Kayla, thank you for this, and thanks for the leadership of the exec's office on these policy bills. You know, this committee asked last year for get this earlier, and you guys are doing it. So I think this is a clear evidence of responding, and we really appreciate it. Another clarification on the 90-day Medicaid waiver. You mentioned a couple of services. Are they delineated specifically? And I guess my question would be, in that 90 days pre-release, would individuals have capability to meet, for example, with supportive housing navigation? So there's a Medicaid benefit, right, in supportive housing, and it can work with people, before they're in housing, and it can stay with people when they're in housing. So, if they're deemed eligible. So I wondered, are those very delineated services, only specific ones, or,
there's this big document that talks about the services, and I don't know how specific. I've scanned it but not read it super in depth, but I can send it to you, Mike. It talks broadly about case management, reentry, care coordination. I can't remember if it's naming the specific services, but clearly connection to housing has to be part of that, right?
Yeah, and I think that,
and I don't know about the Medicaid waiver connection between the two different transformation projects.
Well, that would be great to look at. And then just a comment on the third bullet, which I think is always important. And I would just say, as you're addressing the incarceration task force, and I know that we're having an upcoming presentation about social impact bonds, but housing specifically for those that are justice involved, and to whatever extent, that fits within the exec's priorities and the Washington Association of Counties, I think that's really important. And I think we do a fair job of trying to bolster affordable housing in the community. But what I see is a real dearth of housing that is targeted towards individuals that are justice involved. And I think it really underscores and could support some of the programs that we're talking about, some of the diversion programs that we've talked about today, even lifting up a new one, a prosecutorial diversion, or a 23-hour relief center if we've got places for people to go, right? And so I would just like to just offer that from my perspective on this behavioral health subcommittee, I would really like to see some funds targeted for that. So we don't feel like we're robbing a family project, right? That we're able to do that family project, have it fully funded, but also to get a separate stream that would allow us to get housing for justice involved.
Mike, do you mean like outside of the trust fund?
Probably, because the trust fund, while it wouldn't preclude a project serving those individuals, the prioritization of that population and exclusive prioritization is not necessarily supported by WishFIC and the Housing Trust Fund. Brian Thane's on the call and could probably talk more, but usually, and they always require you to go through coordinated entry, which is not a terrible thing, but it is difficult to really effectively target a particular population based on an experience of constantly in and out of jail. And I think that's a missing kind of link in our community.
Okay, thanks, Mike. That's good feedback.
Peter Frazier, then Brian, then Courtney.
Hey, Kayla, thanks so much for putting this together. And I echo Mike's response that doing this early and at this time is so important. And thank you for leading up this effort. Mike also said what I was going to bring up, which is our great need for reentry housing. And I'm really hoping that this is something that we can, that our legislators can lead on. And when it comes to behavioral health workforce, I am really hoping that we can encourage our legislators to take the lead on a bill for that increasing that pipeline, because we're so desperate, and somebody really needs to show that leadership, and why not here? So thank you.
Thanks, Peter. And I know we have other questions, but I just wanted to provide a little context to Peter and Mike's points about housing, that we do intend to release an RFP in 2024, possibly even 2023, for $2 million of funding targeted towards small capital projects for reentry housing and justice involved individuals. And perhaps that complements one of our other therapeutic court programs or provides a continuum of services for a prosecutorial diversion program. And then we do see an opportunity to think about getting in the pipeline of trust fund and tax credit projects for a larger reentry housing project. So just like that's sort of, yes, the state providing dedicated resources for this is critical, but also sort of absent that, we still have plans to proceed and utilize the resources and growing pie at the state level around housing funding and some local funding too.
Brian, just go ahead.
Yes, again, thanks for putting this together. Since this is a short session, my sense often is if the legislature's not inclined to, develop new programs and fund them, it's more kind of fine tuning. And often some of these agenda items are more issues that would likely be undertaken in full scope in the following legislative year. I just wondered if you could briefly comment on that. And secondly, could you just explain a little bit more the social determinants of health and public health? What would that legislation seek to accomplish?
Yeah, so I'll take that first. On the public health and social determinants of health, we're going to be asking the state to fund foundational public health services, which funds the core capabilities of our health department to provide environmental health services, communicable disease services, health impact assessment services, communication and messaging. So we'll be making an ask there, which is sort of consistent with stuff that's the legislature's already been doing. And then on the social determinants of health, that sort of reinforces the message around housing, around childcare, around sort of an anti-poverty agenda, food access, basically bills that reduce poverty, improve livability, and increase equity for folks in our community and statewide. But no specific bill, just we will support those types of bills generally.
And finally, just one other question. Do you entertain supporting certain federal legislative actions? I know there's a bill in the Senate right now. I think it's S642. I could be wrong about that. But it essentially involves, I think, student loan forgiveness for behavioral health practitioners. I mean, this is a separate category, but I'm just kind of curious, does the council ever take, you know, advocacy actions related to our federal representatives?
Yeah, we have a lot of dialogue with our federal delegation. They're generally supportive of these types of things and endeavors. We struggle to figure out like where our impact is at the federal level and whether we focus our energy through the National Association of Counties or we hire a federal lobbyist. And so I think certainly we can communicate support to our federal delegation for those types of bills that are helpful and in line with this. I just sometimes wonder what our impact as Whatcom County is going to be.
Before I get to Mike Parker, Courtney had her hand up and then withdrew it. Courtney, were you wanting to say something? Or?
Yeah, it was when it was following Mike. I was just going to chime in about coordinated entry and say that, you know, like Mike said, yeah, it has its purpose, but for folks that are reentering the community, and for reentry staff, sorry for the background noise. Right now we currently have, I think, 3 or 4 reentry case managers at the jail. They're fully staffed now. So that's a big celebration. But for them and for our office, when we're working on housing next steps, it's very difficult to connect someone to coordinated entry, you know, with the timing of everything with release, that they have to present physically to OC to enter coordinated entry. There's a lot of limitations with planning ahead to get someone, you know, streamlined to housing if they're coming right from jail because of the way housing is set up in the county right now. Unless you're, you know, looking to try one of the placements outside of coordinated entry. But for a lot of our folks, like some of the sober living homes, it's very limited with what they can provide for some clients, and they're not staffed to provide certain services like other places.
Thanks, Courtney. Kayla, did you want to respond to that?
No, I just wanted to like flag time. I'm happy to keep taking questions, but there's one sort of key question at the end that I want to pose to the group. So I just want to leave time for that before we.
Yeah, we're sort of running out of time here. I think we're at 10:19. Mike Parker, go ahead.
Really quick, I was going to chime in on what Brian Estes brought up about a coordination with our federal delegation and behavioral health workforce. The behavioral health subcommittee, Dan, correct me if I'm wrong, is a little over a year ago. This group brainstormed over a couple of sessions some suggestions about behavioral health workforce and had a number of people, including folks in the profession and working in various agencies. And we came up with a kind of a short list. And Kayla, I think you're right that pay is certainly a part of it, but it's not the only part of it. And so thank you for your offer to talk further, because I think we'd like to share some of those, and I can go through our minutes and see what our recommendations were. But they included partnering with educational institutions, student loan payoff, maybe relocation bonuses for those that might relocate to the area. So I think there's kind of a suite of options, and I'd like to follow up with you, and thank you.
Yes, please send it my way and let's talk more.
I would just add to that, there was a paid internship question that got answered when we invited the Whatcom Community College SUDP coordinator or director here at the Behavioral Health Committee. Brian Estes, is that a new hand or is that from before? I think that's from before. Kayla, do you just want to keep going?
Yeah, I'll keep going. Okay. Operating budget. Whatcom County is going to be partnering with the state to ask for a 5th Superior Court judge. This would be funded in the short term by the state because of the water adjudication process, but the judge would be a permanent position. So
I'm
we're gonna be
sorry.
making that ask as well as some companion asks to RCW amendments that would be necessary. We're gonna be asking sort of for ongoing and sustainable funding for Whatcom County's LEAD program. Our state grant for that is expiring. We're gonna support the DSHS ask for prosecutorial diversion. And then just general support for the state funding substance abuse treatment and crisis services and ensuring that we've got our competency system going again. So that's on the operating side. I'm happy to take questions and feedback there, but sort of the big place where I'd like to have some discussion now or in the future is on the capital budget ask. So any quick questions before we get there?
Committee? Questions? Brian, I still see your hand up. Do you were you wanting to chime in on this question that Kayla just posed?
No, I'm sorry. I can't seem to figure out how to lower my hand. I'm on my phone.
It's
Just
okay.
ignore it.
Okay, sounds good. Doug Chadwick, go ahead.
Yeah, Kayla, just real quick, what's the ask gonna be for LEAD?
Hold on, let me see the number. Looks
No, I
like
mean,
we're gonna be,
is it for staffing? Is it for,
it is for staffing. It's just continuation, so it doesn't represent an expansion of services. I don't think what we're asking for. I think we're gonna be asking for around $600,000.
okay. And this is just my perspective from the law enforcement side is, we talk about, we've got this LEAD program, but we don't have the facilities and the services to divert them to. So
Yeah.
our officers are contacting people and they have nowhere to take them to. So having the infrastructure and the staffing in place first, and then pushing that out to law enforcement, because when there's no place to go, they become frustrated and it's ineffective, and they stop even trying because they get turned away so many times because they say, well, we'll call them back in a week, or we can't take them at the crisis stabilization center because they don't meet our criteria. So
Yeah,
that's my 2 cents.
thanks, Doug.
Other questions?
Okay.
All right, seeing none, go ahead, Kayla.
On the capital budget side, I mean, I think the state's really gonna have to step up its game on funding behavioral health facilities. We've been getting grants through direct appropriations. The competitive grant program is really small. So we just need some more state leadership there, and we'll be supporting that. But I think we aren't planning a specific Whatcom County facility ask for 2024 since it's a supplemental budget year. But like, it's not inconceivable that one of our legislators is going to come to us mid-session and say, hey, we have some extra money in such and such account. What's your ask regarding another behavioral health facility? And I think we want to be prepared for that. And then certainly want to be teeing up an ask for 2025. And I don't, I guess I just want to flag for this group and other committees that you all work with that I don't know that we've reached consensus or even had those discussions on what the next facility-based ask is, right? So are we asking for state money to build our behavioral care center? Are we asking for a reentry resource center, which I know that many of you have been involved in that ask before? Are we thinking about inpatient substance use, co-occurring, mental health facility? As we look at the justice plan, right, we talk about regional planning and continued conversation around inpatient treatment. And so this is just that flag that I don't expect us to come to any conclusions today, but want to get it on everyone's radar that we need to be prepared and hope we can have some consensus and good discussion as legislative season approaches.
Committee, we've got 3 minutes to figure this out. Just kidding. It's a huge ask. I think this conversation needs to continue into our next meeting, Kayla. I think that we want to invite you back to provide some more input on this. This is a huge opportunity, I think, for us to chime in on these pieces. So, committee, do you have any questions right now for Kayla or any input that we can provide for her today?
Dan,
Yeah.
my only input, and it's outside of the purview of this committee, is that there's a desperate need for a pediatric inpatient facility in the North Sound. And I know that's not something that, this group entertains, but given some of Heather's comments earlier, I really think it's something that the county through the ASO should get behind in terms of capital priorities going forward.
Okay, thanks, Brian. Peter Fraser, go ahead.
I'd like to recommend that we focus on this topic in our next meeting. I'm not sure what else we need to focus on, but this is so important. And I would encourage Kayla to put together a packet for us for anything that we can read before the meeting that would help us to be ready for making some decisions around this and being helpful.
Thanks, Peter. I don't know that I have that much to offer all of you, right? Like, you are the ones who are in community and working in this field, and to the extent we can consult other groups that are working on these very issues. You know, Perry facilitates a number of committees that touch this subject, and so happy to do some legwork. I just don't really, I mean this sincerely, like I just don't know what to say. I don't know. I can provide background on what the county's asked for in the past related to a reentry resource center, what a behavioral health care center could do, but I can.
Well, I guess
I look to you all about the need and defining the need.
Sure, my ask maybe is not so much to you, but to the group. I'm very interested in doing some work up front, and I'm fairly new to this committee and would like to engage on these before the next meeting. So.
Okay, so we are near the bottom of the hour. I just want to provide just a brief level of detail here. So the legislative agenda that Kayla's talking about is a shared agenda between the city, the county, and the port. And so the city shares, from my perspective, these objectives when it comes to behavioral health and housing in particular. But we are lacking in the mayor's office. Brian Heinrich moved to a different position in the community. So we don't have that policy and legislative advocate anymore. So we're trying to fill that position. So we're in a bit of a flux period here. So this committee does play a very central role in terms of providing input for both the city, county, and the port. So I just want to make sure that that we do provide that input to help Kayla. And I do, Peter, I do share your idea that we should have some kind of packet or some kind of like thing to mull over. And perhaps Perry, maybe you could help provide some kind of background on that as the staffer. And I'm seeing some hands go up, and I know that we're kind of running out of time here. Jill Nixon, you had your hand up first, then Stephen Gockley.
Yeah, just about the November agenda, I wanted to let everyone know that we're working on having a presentation from the executive or Tyler on the 23-hour crisis facility services. So if you would like to schedule Kayla as a co-agenda item, or we can put the 23-hour crisis facility services agenda item off to December, that's an option as well. And the December meeting would be a joint meeting with the Legal and Justice Committee.
Okay. I saw Mike Parker shake his head. I don't know if that was.
Well, I don't want to kick that 23-hour center. I think that's really important. Kayla, if it's possible, maybe you could join. I think actually some of the things you're talking about was advocated last year. Now we're talking about how to implement. So I don't see them as being really divorced. I see them as kind of being aligned. And if you're willing to join us, but I think that's really important and prescient timing, the 23-hour facility.
Yeah, and I also, sorry, I can't help myself. Just want to say we turned our paperwork into Commerce yesterday for our readiness survey and our pre-contracting paperwork for that facility. So that was really exciting.
Stephen Gockley, go ahead.
Yeah, I want to endorse Peter's suggestion that we get to this as soon as possible. What we haven't talked about and what I think Kayla put up there is a discussion on the prioritization of some of those projects, because we can't do them all at once. And we haven't had that conversation. And just without being a procedural stickler, I would say these are not recommendations from the Behavioral Health Committee itself directly into the pipeline, that they ought to be recommendations from us to the task force and try to get a broader consensus from that body, which is really the voice that Kayla ideally is listening to.
Fair enough. That's it. You're a good stickler. Thank you for being on top of it. Okay, so any other questions from the group or any comments? Okay, seeing none. Jill Nixon, do we have any public comment?
Yes, thank you. We do have one attendee today with his hand raised. Jason, go ahead and speak to the committee.
Good afternoon. My name is Jason DeForest, local business owner. Want to speak to a couple things. First, the land acknowledgement. I'd like to say that I look forward to a day when we also have a police acknowledgement and a healthcare worker acknowledgement for the things that police and healthcare workers have done over the years to folks that are vulnerable and that are in need of assistance and they aren't held accountable for. There is an opioid epidemic in our community, but there is also an epidemic of police and healthcare worker misconduct. They need to be held accountable. You can spend as much money as you want on any service, but until you get into the hearts and the minds of the first people that interact with these folks, nothing is going to change. Until you can get a police officer to walk up to a junkie and hold his hand and help him, nothing is ever going to change. Thank you very much.
Thank you, sir. Any other speakers today, Jill Nixon?
I don't see any other speakers today.
Okay. All right. Well, thanks everyone for your time here this morning and appreciate it. And with that, this meeting is adjourned.